Thank you very much and welcome everyone to hour 15 and the 15th reason for hope and optimism. Clean energy is obviously good for the planet. It helps to solve the climate crisis, but it's also good for human health. By reducing our dependence on dirty and dangerous fossil fuels, we improve the quality of the air we breathe, the water we drink, and the soils in which we grow our food. As a result, the lives and livelihoods of billions of people all around the world are improved. So as we make progress toward the development of a clean energy infrastructure, we will have the opportunity to live longer and healthier lives. The consequences of the alternative, continued dependence on dirty fossil fuels, are already painfully clear. Good health and renewable energy go together. So, reason 15 for hope. Public health is improved by using clean energy. We already can see the collateral damage being done to the health of human beings, including children, with the massive coal burning in China. There has already been a reduction of life expectancy in northern China by an average of 5.5 years, just as a result of all of the pollution that comes primarily from burning coal. We have seen the Shanghai Academy of Social Sciences earlier this year make an incredible statement that the pollution index in Beijing had neared extreme levels and therefore is near a level that is no longer livable for human beings. Wow. Anybody who has been to Beijing or Shanghai and several of the other cities in China has had the opportunity to witness days in which visibility is very, very low. And the effect on your lungs is such that many people who live and work there, if they can leave, some of them are taking advantage of the opportunity to move away. Some businesses are relocating their headquarters and their families away from these heavily polluted cities. That also cost, but the health cost for the people who have to bear up under that air pollution is really quite extreme. So this report that just came out yesterday at the UN, the Calderon Commission, noted that in the 15 countries with the highest emissions of global warming pollution, the damage to health from poor air quality, largely associated with the burning of fossil fuels, that's in their words, is valued at an average of 4.4% of GDP. That's incredible. That is a huge number. The economic damage coming from the health impacts of continued over-reliance on dirty and dangerous fossil fuels can be reduced with this revolution in the availability and affordability of renewable energy. Death by power plant. These are health statistics from the United States that show the health impact of living near an existing power plant. And here are the plants with more than 15 million metric tons of CO2 being emitted each year. It's not the CO2 that is causing the health impacts. The CO2 causes the impacts to the planet as a whole. The climate crisis, that's the main cause. But the collateral air pollution flows that come as the CO2 is released cause these incredibly dangerous health impacts. This is a look at global deaths due to air pollution. Now, I want to show you a really unique, unplanned experiment. It involves air pollution and health. And it took place a few years ago in the area around Salt Lake City, Utah. Now, this was not the emissions from a coal plant. This happened to be a steel plant. But the particulate matter polluted into the air looked like this during 1985 and 1986. for a considerable period in the midst of this time, the plant was shut down. And the particulates that made up the air pollution in this area went way down. Were there any measurable health consequences? Well, let's look at these same 3 periods of time: before the plant shut down, while the plant was shut down, and after it started back up. Okay, here are the admissions to the hospital for bronchitis and asthma. And you can see the admissions to the hospital dropped dramatically at exactly the same time that the emissions of these particulates dropped. Similarly, for pneumonia and pleurisy, the pattern is identical. So if there was a TV show called CSI Climate and Health, this would be a fingerprint that showed the connection between air pollution and poor health. In fact, in the United States as a whole, going back now to focus particularly on the burning of coal, the biggest source of air pollution, coal use, including the extraction and the burning of coal, costs the United States every single year in health costs $261 billion. It really is quite incredible. This is a Harvard University medical school study. The amount of mercury that is near the surface of many of the world's oceans has tripled as a result of human pollution, principally from the burning of coal. Now, earlier we saw a film that featured one of our field reports that featured the consequences of reliance on these dirty and inefficient indoor cook stoves that create a lot of indoor air pollution. Here are the statistics showing that around 3 billion people cook and heat their homes using these open fires and organic material, and over 4 million people die prematurely every single year from illnesses directly attributed to these open, inefficient cook stoves. And children make up more than 50% of the premature deaths. More than 50% of the premature deaths among children under 5 are due to the pneumonia caused by the soot that comes from the burning of this cooking fuel in an inefficient way. By contrast, the clean cook stoves, and you saw a bit about this in the field report, have reduced toxic emissions by up to 80% and have saved many thousands of lives. Better yet, the solar cookers that are now increasingly available emit no pollution whatsoever. And the designs are improving. There is a competition to come up with even better designs. Here is one being used in Tibet. This is a hospital powered by solar energy in Nepal. There are 6 health clinics in western Nepal now powered by solar energy, and they have round-the-clock electricity. So the health benefits of switching to renewable energy come not only in the form of reducing the illnesses associated with the air pollution that comes from excessive burning of coal and other carbon-based fuels, it also creates benefits by making health care more available with clinics like this one. Here is a solar-powered clinic in Bangladesh. It also doubles as a school. Now, let's go back for a moment to consider what this means, this major report that came out yesterday from the UN, linking the extremely high cost of health impacts from the burning of fuels that also result in the release of all these greenhouse gases. It's not just air pollution. It is also water pollution. It is also the pollution of food crops, because when the mercury and cadmium and other air pollutants that come from the burning of coal settle on the croplands, the plants pull these toxic poisons up from the soil through their root system into the plant, and they are consumed by people. This is an extremely serious health matter that can be solved. And the good news, again, the reason for hope in this 15th hour, is that we can improve health outcomes, and we can save thousands of lives by switching to solar electricity and wind electricity and the whole panoply of renewable energy technologies. This is yet another collateral benefit. Here is a hospital in the United States that is now being powered in a significant way by solar panels. So this reason for hope is one that has benefits for people in the developed, wealthy countries, as well as in the developing countries around the world. And after all, saving lives, particularly saving lives of children, is also one of the ways to help stabilize the rate of population increase, simply because human nature is such, this has long been understood, that when children survive at a much higher rate, the natural preference in most families is to have smaller families. So reducing child mortality and improving child and maternal health is one of the ways to effect the demographic transition, the so-called demographic transition, which takes the world from a pattern of large families with high death rates and then high birth rates, down to another pattern characterized by small families, preferred by most, when they have their own free choice, with low death rates and low birth rates. So an African leader, Julius K. Nyerere, said almost 70 years ago, the most powerful contraceptive in the world is the confidence by parents that their children will survive. So this is a virtuous circle. When we get off of dirty fossil fuels, embrace renewable energy, we improve health outcomes. When we improve health outcomes, we give families the opportunity to make the kinds of choices they typically wish to make, and then we empower nations to have a more sustainable pathway into the future. So the improvement of health outcomes by a much wider use of renewable energy has many collateral benefits. And when you look at the overall pattern of all the benefits from embracing the renewable revolution, it's easy to see how this is the 15th reason for hope.